The Community University Healthcare Center, or CUHCC, is the premier ambulatory urban health teaching center in Minnesota. Each year, CUHCC trains more than 225 future healthcare professionals from the University of Minnesota schools and programs, including medicine, dentistry, psychiatry, social work, public affairs, nursing, public health, language studies, and more. CUHCC's preceptors and faculty synthesize their academic knowledge with years of experience in urban medicine.
Our preceptors at the university are some of the best minds in the state of Minnesota. Each preceptor is involved in things outside of CUHCC Clinic.
They really value your presence, they really value your input, and they really are eager to teach.
The residents that come here are fantastic. And so I'm just so lucky that I'm able to work here, work with all the fantastic people from Dr. Davidi to Dr. Reif.
I find such a joy in teaching residents the art of medicine, basically. Because science of medicine you learn in medical school, but the art of medicine is different. And you have to do the medicine from heart to get to the real medical diagnosis. That's what I like teaching my residents.
Students and residents training at CUHCC work with a variety of professionals to deliver integrated care to meet the needs of complex patients.
And even in the medical providers, we have such a diverse group of med-peds providers, internal medicine provider, pediatric providers, nurse practitioners, midwives, family medicine.
The dentists, the pediatricians, the family practice folks, the psychiatrists, we meet regularly just to talk about the scope of patients and from their social setting to a medical setting.
And the interpreters, the arms workers, the case managers at CUHCC are essential.
It's just a broad range of providers here to support each other.
CUHCC is located in the Phillips neighborhood of South Minneapolis, a global community where 29% of residents are foreign-born and 1 in 5 don't speak English. Staff members at CUHCC speak 7 languages, with translators available for even more.
I can see folks from Africa, from Somalia, from Southeast Asia, from all over the world. And it is a diversity that is unbelievable. And I've learned so much and grown so much being part of that.
I really don't think I have a clinic day where I have an English-speaking patient all the time. I'm always working with interpreters. I'm always working with diverse ages, from newborn babies to elderly patients, who have come from really every walk of life in every corner of the world.
Many of CUHCC's patients are refugees from war-torn areas and suffer from conditions rarely seen in Middle America. Others have conditions that are aggravated by poverty.
I think CUHCC is the perfect place to work with patients with comorbid conditions. At CUHCC, virtually every patient, every visit, every waking moment, there are patients with layers and layers of issues.
Tuberculosis and seizures and pseudo-seizures, but also post-traumatic stress disorder and depression. So really learning how the mental health and the kind of physical, or what we think of medical problems, fit together.
CUHCC is an exceptional place to learn and get experience in urban health.
CUHCC is a wonderful place for students to come to receive their education.
Everybody at CUHCC has that philosophy where the patients go first.
This has been a fantastic experience for me.
I wouldn't trade my time at CUHCC for anything.